Come join us each week as we dive into topics about the joys and the struggles of motherhood. By no means are we experts. We're practically flying by the seat of our pants, or should I say, mom jeans. On this podcast, you will find a judgment-free zone where we discuss not only the best parts of being a mom, but the not-so-glamorous parts too. You can expect unfiltered, real mom talk, humor, grace, and a sense of sisterhood. What makes our podcast unique is that we understand there's no one-size-fits-all approach when it comes to being a mother. We're not going to pretend that we know everything too, because we definitely don't. We just want a place to share our stories with you. Thank you so much for tuning in to Mom Jeans, trying to fit into motherhood. Welcome to another episode of Mom Jeans. Thank you so much for joining us today. We have another guest, Ashley. She's a friend of mine, and we're so excited to have her. She's going to talk about her story of having her two babies and high-risk pregnancy, and then also about pregnancy loss as well. So she's going to be giving us her story and just talking about how she went through those challenges in her and just her journey of getting her two beautiful children that she has today. But before we start with that, sorry, Lisa. Also, so Ashley and I, we go back a little bit. Our husbands are actually best friends from kindergarten. They lived in the same neighborhood, and they're still best friends. And so that's kind of how we met. Oh my gosh, probably almost 10 years now. It's been a while. So I'm just excited to hear your story all in one place. So we'll get to that here in just a little bit. All right. So, but first, before we get started, we're going to do our high-lows. And let's start with Lisa. High-lows of the week.
We went to an allergist for both girls because their eczema is really bad, and the doctor wanted us to just make sure that there wasn't any allergies driving the eczema. And we got down to the allergist, and he immediately goes, "So it's really rare that allergies drive eczema." And I was like, "Oh, good. Okay. Glad we're here." So they did the allergy tests on them for environmental stuff and then also food. And they tested negative for everything. So that was really good. And, we went right away and got them peanut butter and yogurt and everything that they can have. So that was a high. That was a super, super exciting thing. And then another high of ours, which I'm really enjoying right now, is Hannah, who's 2.5, cheerses everything that you have the same as her. So she just got her first pair of Crocs, and I wear Crocs all the time. And she goes and she like toe bumps me and she goes, "Cheers." It's like, okay. And so like if I have, a fork in my hand and she has a fork in her hand, cheers. So it's very cute. I really, really enjoying that. And so that's been really good. Yeah. And then lows, just the same normal stuff, the same, am I doing enough? Am I a good enough mom? Am I da 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 da? So
Lisa, did the allergist give you any suggestions about the eczema, or did he really just say like, "I don't deal with this, but we can do a test anyway"?
He was actually pretty incredible. He gave us a bunch of creams, half of which we already have used, but a new one. So we're going to try that on Aubrey's face, which is good because her face is really super dry. And then he also gave us his cell phone number and said, "Text me anytime you have a weird thing on them and you want to know if it's allergy related or if I can give you a suggestion." So that was good. And he also said he's a little bit concerned about how many infections they've both had, ear infections, that is. And he wants us to get a full blood draw to see if all their numbers, their panels come out clean, which, we're trying to decide whether that's a good move for us and whether we'll actually do that or not. So, yeah, he was awesome. We really liked him. That is the benefit of going to those big towns that have the specialists. Really enjoy that. So
that's good. You at least got some answers.
Totally. We're happy about it. We're glad we did it and we could rule those out.
Leah, how was your week?
My week was good. So I think since our last episode, we moved into our new house. So that's super exciting. I'm just trying to make the goal of like one box a day, and then to my goal is to be fully unpacked and have my gym set up by my birthday. So a couple more weeks until that comes around, and I think we'll make good progress. I actually did like 4 boxes today, so that was a super big win, getting everything in place there. Uh, Weston took his longest daycare nap ever today, so big win for everybody all around there. Except the difference is that he was extremely energized when he came home from school, and I felt like I was sprinting at 100 miles per hour until the minute I put him down to bed. So I'm a little exhausted today from that, but and honestly, I don't think I really had a low this week. We had family here visiting. We had the new house. I mean, the weather was great. I think it was
awesome.
just a really good
That's
week.
a win for sure. And Weston does the same thing where he like after dinner he just runs constantly, like back and forth, and he's hyper and climbs everything. So I feel you on that.
Hey, Tommy does the same thing. As soon as he eats dinner, he wants to play with toys and sprint in the backyard.
Do zoomies.
He does. We have to tell him to stop so he doesn't get bloat, but he loves to do his zoomies right after he eats.
Oh, that's awesome. Well, Michaela, how was your week?
My week was good. We celebrated my husband's birthday, which was a couple days ago. And to do that, we went down to the valley for just a night and had a little staycation, just the two of us. And if you guys haven't gathered from previous episodes, my husband is kind of a big child, and especially when it comes to water. So we went to a hotel that has a really fun water park, and he just had a blast going on all the water slides. So he turned back into a 36-year-old 5-year-old, which is always fun. And yeah, I don't really feel like I have any lows either. I've been dealing with some weird back pain that I can't really attribute to anything, but it gets better during the day. So I'm not letting it get me down. So yeah, all in all, pretty good week.
Nice. Does that mean we're getting older? I feel like.
Yes, unexplained back pain. Yes.
Oh, well, let's see. My week, Weston is finally starting to connect and like say words. Like he's making sounds you can tell that he's trying to say whatever it is. Like the other day I put bananas in the shopping cart. Actually, I call it a buggy. I don't know why I say shopping cart. I'm conforming. That's not cool. My southernness. We put it in the buggy, and he looked at him and said "Anna's" for bananas, and I thought that was cute. And then my favorite. This is probably really bad, but when he sees the cat, I say "kitty," and he said "titty." So he calls the kitty a titty. It's too cute to
That's incredible.
He hasn't got the down yet, so that's been really fun to watch for him to make this connections. At least he's close.
Is it distinctly titty, or
I
is
feel
it
like I hear
itty?
Because I'm like, and so he thinks I'm saying t. So I said titty, yeah, when he sees the cat. So guess there's worse things, but yeah, that's been really, really fun. But he's climbing everything, so I'm constantly moving. I'm really surprised how many steps I get in a day. I thought being a stay-at-home mom, I wouldn't get as much steps as I did as like working as a PE teacher. Not true. That's all false. Like we're constantly moving, and he's just on the go. So that's been really fun. Not really any lows. I did find out. I went to the doctor and they're going to have me start a medicated cycle. And I thought I was going to get the start this time around. But she wants me to have a pelvic exam before we do that, just to make sure everything's good, where I had a C-section and stuff. And so that means I'll have to wait another cycle. And I'm just like trying to be hopeful that it'll just happen naturally still. And it's just hard to like, when I get my hopes up, and then, so I'm just trying to like not have high expectations, which is sad to say, but it's just, I'm to that point to where it hasn't worked yet. So we're just gonna have to take the next step, and hopefully it'll work the first time. The doctor is like, it might not work the first time like it did last time, just so you know. It doesn't happen like that every time. So I'm just trying to prepare myself. yeah, for that. So I guess that was just a little bit of a low this week. But other than that, things are going great. Ashley, how about you? How was your week?
My week's been good. So I have a 7-year-old daughter, so she's been off of school now for a couple weeks. We're kind of getting into our summer routine. I took my kids we go to Lifetime Gym, so I took them to the pool yesterday, and no meltdowns. It was actually a really fun outing, so I was very proud of myself, because usually I'm like, why did I do this to myself? And then, I don't know if I really have a low. I guess kind of like what Lisa said, just sometimes I get really frustrated at the end of the day, especially when I've worked and then I come home and my kids are crabby and I'm, picking up my house and I'm just like, this is a lot. Like, motherhood's a lot. So, we have those moments where I get frustrated and then I immediately regret it. I'm like, I shouldn't have been like that, especially when my daughter's dragging her feet and I'm trying to get out and I'm like, you're going to make me late for work every single day. And it's not her fault, but, it's just easy to blame. So it's hard. But we're just doing the best we can day by day, and
Absolutely.
they still love us, so it's not like we've completely went off, but it's just hard. So
Yeah.
Ashley, what do you do for work?
So I'm a nurse. I actually am a pediatric oncology nurse. So I've worked I graduated 2010, so I've been a nurse for 14 years. I went to ASU. 2010 was when the job market was non-existent. So I ended up moving to Dallas, Texas. I worked at the Children's Hospital out there, and that's actually where I met my husband. But he's from Flagstaff, so he did the exact same thing as me. We just both couldn't find jobs, ended up out there. So it was kind of an easy compromise. 2 years later, we're going to move back to Phoenix and get jobs. So I work at Phoenix Children's Hospital in the oncology clinic. So I'm doing like a 8 to 5. I work 3 days a week, so no weekends, no holidays. I did the inpatient nursing for almost 13 years, and I was just like, I am done with the 13-hour days, the long days, weekends away, holidays away. It was just hard. So it's a good balance. Still getting to do what I enjoy doing, but not the long hours.
That's great.
Yeah, that's awesome that you're able to have a nice work-life balance, like flow with that. You said something that reminded me of a funny story. It's a little off topic, but you met your husband in Dallas, right?
Yeah.
And it's been a long time since I've heard this story, but you and your friend swapped names, right? When y'all met.
Yeah.
I forgot who he was with, but yeah, y'all pretended to be each other. And then how did that work out when he...
Well, so we we were single and going out, and we were like, 22, 23, and guys would come up to us all the time, and it was like creeper after like 35-year-old, just like, I'm not interested. And so we kind of came up with something after like 2 different encounters of people that night. And I'm like, you know what? We should come up with fake names in fake occupations and just totally run with this. Like, if somebody comes up and we're not getting a good vibe, we'll introduce ourselves as our fake name. And it was like, if the first person introduces themselves, if they introduce as the fake name, we have to like commit, both of us. So we agreed. And then literally my husband's friend that he was with walks up to us, and my friend was like, hi, my name's Stephanie. And I was like, oh, we're doing this. And so I think I was like a dental hygienist. She was a teacher. We knew nothing about she was a nurse too. So it was just fun. But then I very quickly realized that, my now husband wasn't really a creeper like all these other guys. And so then we hadn't really ever talked about, well, what do we do if we do that? And then we realized that we need to like take it back. So I told him pretty quickly, like, hey, he totally understood, this is the situation. It's not really my name. That's not really what I do. And my friend and I went to the bathroom probably an hour and a half later, and she's like, how do I tell him? I'm like, oh, I told him like an hour and a half ago. So she's just been, playing off the game for like 2 hours. It was pretty funny. But then Tyler asked for my number. I told him my number, and he got it wrong. So then he was texting somebody, and I wasn't responding. And then it must have been a guy because he finally was like, hey, man, like, you have the wrong number. And so I was like, I can't believe it. He totally blew me off. I was so mad. Anyways, it's a really funny story.
So funny.
And then,
so how did you reconnect?
well, thankfully, my friend also exchanged numbers with the other guy. And so we ended up, she asked me, and I was mad. Like, me and her talked every day. And I was like, why have you heard from him? I haven't heard from him. This is so weird. I really thought things were going well. And she invited me to go out. Like, we were going to watch like a Dallas Mavericks game. I think it was when they were in the playoffs. And she didn't want to go alone. So I was like, I'll come with. And the first thing he said was, how come you gave the wrong number to Tyler? And I'm like, I didn't give him the wrong number. And so then he was texting him and realized the number. So it was totally his fault, but it was funny. So, I mean, thankfully, because I don't know what would have happened if my friend didn't actually end up, you know, it's just funny. And we say all the time, like, I love her to death and I love her husband, but like, they're married now too. If it would have switched, it would have never worked. Like,
wait,
if she would have,
the guy that she met at the bar is married to.
Yeah.
So you guys both ended up with those guys?
Yeah.
How do they both
That's
feel?
Unbelievable.
How do they both feel knowing that they gave off creepy vibes to her when they first approached you guys?
I honestly think that my friend just really wasn't thinking, and we literally had just talked about it. And
she's probably
I think
just
she
amped
just kind
to
of,
be Stephanie.
yeah, she just jumped in, and I'm like, okay, we're doing this. Like, we agreed to it. And so, yeah, anyways, it was funny. But, yeah, they got married before we did. So we've both been married I think they've been married for 10 years this year. And we've been 9 years, but it's just crazy. And then I found out probably a week after that his real name's not Tyler. So then I was like, who's really telling the truth? I made him show me his driver's license. Tyler's his middle name. And his
I didn't know that
either.
Yeah, his first name's David, and his parents named him David, didn't want to call him David. So they've called him Tyler his entire life. It's complicated because now everything legal. Like, we went to buy our first house, and he, you know, introduced himself as Tyler Holmes. So all of our paperwork was under Tyler Holmes, and they had to redo it because I'm like, it's not really legal. Like, I could walk away with the house because it's not you. But
I'm gonna have to ask Ryan if he knows Tyler's real name. Do you think he does?
I'm
gonna
sure
have to
he
ask
does.
Bryce too.
If Ryan doesn't know his real name, that might be a problem.
Yeah.
Like, they've known each other for so long. He had to have corrected himself every single year in school, right? Like, when they say your name and you're like, I actually go by Tyler.
Yeah.
But it's funny. Anyways.
I would bet money that Bryce doesn't know.
You'll have to let me know. It's really funny. Yeah, it's a funny story. My dad actually had never heard the real story, and we were at our rehearsal dinner, and we were telling it, and so then he told everybody at the wedding the next day. He's like, I just learned this story last night. It's so funny.
I was just going to say that's one of the best marriage meeting your spouse stories I've ever heard, and the fact that your friend married the other guy too, like, that's just, that is I don't even want to say Hallmark movie because that's a better plot line than any Hallmark movie would ever be able to come up with, but like, definitely a chick flick.
Yeah.
Awesome. All right, well, we'll kind of dive in and just tell us a little bit about yourself now. We know that where you work and a little bit of your backstory, but kind of like where you're at in your life at this moment.
So I have 2 kids. My oldest daughter, Mackenzie, is 7. She turned 7 in January. She's going into 2nd grade. And then I have my son who just turned 3 at the end of May. Like I said, we live in Phoenix. We've been here since 2012, so 12 years now. So we got married April of 2015, and we always knew we wanted to have kids. We decided that fall, so probably about 6 months after we were married, that we were going to kind of start the process of trying. So I had been on birth control for 10 years, and so I had stopped it, kind of gave myself a couple months to regulate. I didn't really know. They say that's what you're supposed to do. And I also don't really think I really knew fully, the tracking and all the things that goes into your cycle. And so I kind of had kept track of how long my cycles were, but I actually had very inconsistent cycles, and they had really intense like menstrual cycles. So that's why I was started on birth control, and I just stayed on it. So I didn't really know what my body was going to do. So I came off birth control. We ended up getting pregnant with my first pregnancy, January 2016. So, it was probably like 4 or 5 months after we had really started trying. And I called my OB office, made the 8-week appointment like anybody does, went to my 8-week appointment, and there was a gestational sac or yolk sac, but there was no embryo, and my uterus was measuring, I think like a little over 6 weeks, and I should have been 8 weeks pregnant. So my OB had said, let's have you come back in a week. You could have just been off on when you ovulated, when your cycle started. Some things can kind of be really fluctuated. So I, first pregnancy, kind of went into it. Yeah, I have no idea how this works. We went back a week later. Still no baby or embryo. I had the sac. I was measuring 7 weeks. So my uterus was growing. I had something there, but there was no baby, no heartbeat. And again, first pregnancy, I didn't really know when a heartbeat was supposed to be there. So my doctor had kind of said, like, we should be seeing a heartbeat by now. So they had me do the beta HCGs, where you get your level drawn and then you come back 48 hours later and the levels should be doubling or better. And and mind you, I'm like supposed to be pretty much 10 weeks pregnant at this point, according to when I had my last cycle. So my levels didn't double, but they didn't decrease. They pretty much stayed exactly the same. And so my doctor said that I was having what's called a blighted ovum. So it's basically the gestational sac is there, the yolk sac is there. So my body thinks that it's pregnant, but there's no baby that's growing, or the baby was absorbed into my uterine lining early on. And I, again, had no idea what that was. I immediately went to Google. So my doctor had kind of said, basically, this is a miscarriage. This baby's not, there's no viable pregnancy. So we decided to do Cytotec, which is the pills that they do. They actually use it for it's like the abortion pills, or like to basically make your body abort the pregnancy. So you take 2 pills 12 hours apart, and it immediately causes really strong contractions, lots of cramping, lots of bleeding. It's very, very uncomfortable. And it's very emotionally hard too, because you're dealing with having a miscarriage. My body wasn't recognizing that I was miscarrying the baby. And she said, you can continue to try to see if your body will naturally start releasing this pregnancy, but it's already been, pretty much 3 weeks at that point that the baby or the uterine lining wasn't growing and maintaining. So I ended up doing the Cytotec, did it. I probably had like 24 hours plus of bleeding and cramping. Went back to my OB office a couple days later. She did an ultrasound to check, and it looked like, she said it looked like a bomb went off in my uterus. So basically nothing really happened. It just kind of irritated all of that tissue. So all of that, and I still hadn't gotten rid of the pregnancy. So I ended up, she said, you can do another round, or you can go and have a D&C. And I said, I'm not doing that again. Again, it was obviously super emotional. And I just wanted it to be over. So I think I had my D&C a couple days later, woke up and I was like, okay, like I can finally start healing and kind of moving on from that.
Ashley, did you have an option of the D&C the first time around?
Yeah, I did. And I don't know why. I guess my biggest hesitation with doing it, backtracking in college, I had an abnormal pap smear. And so I had what's called a LEAP procedure where they have to go in and like
Oh yeah, I've had
scrape.
it. Yeah, it's horrible.
Yeah. And they're horrible. But that can cause like scar tissue to build up on your cervix. And so I guess a DNC also does. And so my doctor had said, if you're up for it, we can always try like the less invasive route, I guess.
Okay.
So that's why I did it.
Got it.
But then I ended up still having to have the DNC.
Ugh.
So
Do you know how often the cytotech fails? Like, is that a common thing for that to not work?
I don't know. I honestly, I know a lot of people that have had miscarriages. I feel like once you've had one, it kind of opens up
Right.
the floodgates, right? People come and they're like, oh, I've had it. People don't talk about it. And I didn't really talk about it. We were obviously super excited to be pregnant, so everybody knew. And then I had to go back and tell people that we weren't. And it was really hard because it's just not something that you want to have to go back and, talk about. But I don't know. I don't know anybody that's taken them, that has done the pills, that it's not worked. But I also don't know a whole lot of people that have done that. I feel like a lot of people do go the DNC route just because it is the quicker way, and you just know 100% that, everything's going to be cleared and can kind of move on and process it. So my OB had said that we had to have one cycle, and then we could start trying after that cycle I had after my DNC, mainly because when you have a DNC, it's not really your menstrual cycle. So it's hard for them to track and hard for them to know really like your body, where you're at with your cycle. So I think my notes had said that it took me 40 days to get my period back after the DNC, which was longer than normal for me. And then we actually got pregnant the first round after having the miscarriage. And that is my daughter that I have now. So I found out I was pregnant with her. Same thing. We actually ended up doing the beta HCGs to just make sure that the pregnancy was doubling. Everything was looking good. I think my numbers almost tripled. And then my doctor had us come in for like a 5.5-week ultrasound. There was a yolk sac. There was a baby. I almost think there might have even been a flicker of a heartbeat, which was super exciting. And then I only had to go 2 more weeks until my 8-week appointment. But again, that 8-week appointment, you'll learn later on, is very triggering for me because it's always never really been great news. And it's always the kind of the time of my pregnancy that it always turns. And so I was very anxious. But thankfully, everything was fine. So then I did my normal OB follow-ups. And then I got to my anatomy scan with her. I think I was like 19 weeks. And everything looked fine. But they do, I'm sure you guys all remember, they do abdominal and they do vaginal, because they'll do like a vaginal to check your cervix and measure and make sure your fluid levels are all good, and your cervix is closed and, how it's supposed to be. And mine was shorter than it should have been, and it was thinned out, meaning my cervix was already starting to dilate and thin out, and I was 19 weeks pregnant. So here we are again. I'm sitting in the office, and my doctor said, I want you to come back in a week. We'll do another repeat just to make sure that maybe this is just a fluke. Came back a week later, that my cervix was like, I think a 1/10 of a centimeter shorter than it was the week before. So then here I'm 20 weeks pregnant. She said, we're going to send you to a perinatologist, which is a high risk OB, because we might have to do some surgical intervention to prevent this pregnancy from failing. So I ended up going to them at, I think, 22 weeks. So I think it took me 2 weeks to get into them. And my cervix, the guy explained it really well, but basically they do an angle test, kind of like geometry, I guess. And the angle was wider than what it should have been, meaning my cervix was strained and it was shortening and basically effacing. So he had said, we need to go in and do what's called a cerclage, which is a stitch that they tie around your cervix and they tie it tight. And so it prevents your cervix from opening up and shortening anymore. So I had that the next week, and I was diagnosed with incompetent cervix because of that. Basically, my cervix doesn't hold steady very well.
Was that painful?
Was that? Yeah, I was going to ask. Compared to the leap, how did it feel?
So they did a spinal block. I was awake for it. I mean, I guess there's no reason really to be put to sleep. It's really only a 5-minute procedure. And my doctor had said it's, kind of like a glorified PAP where you have a little bit more, cramping that lasts a little bit longer afterwards. Probably it was definitely worse than the leap. I mean, I've had a leap before, but kind of that same concept. But it was just crazy to think like you're tying a ribbon around my cervix and tightening it down. So I remember being in the OR and my high risk doctor was like explaining everything as he was doing it. And he tightened the stitch and I immediately had very intense cramping and like abdominal pain. And I'm like, something's not right. But again, I've never had this done before. He said mild discomfort. So I really just thought like, okay, maybe it'll go away. Maybe my body's just not happy. I am like 22 weeks pregnant. There's probably more pressure on it than there would have been, obviously, when you don't have a baby sitting on your cervix. So I went into the recovery room and it didn't get better. It was really, it was scary. I actually was feeling my stomach. I'm like, I've never felt contractions before, but my stomach was tightening and then loosening. And it did it a few times. And I'm in just a regular outpatient recovery area. So my nurse had no idea what to do. They rarely ever probably do this procedure. And, it's not like I'm in the OB area of the hospital. So I kind of said, like, something's not right. I think you need to call my doctor. He said this wasn't really supposed to be very painful. And I was like rolling around, couldn't get comfortable. My stomach was tensing up. And so she called my high risk doctor, who called my OB. And my OB office is right behind the hospital. So she showed up probably 5 minutes after they called, walked into my recovery area. I took one look at me and she's like, we need to get her to triage or get her admitted to the antepartum unit. Like, we're not sitting here anymore. And so I just remember it being really quick. Like, my husband wasn't even back with me yet. And so I was like, well, can he at least come back? Because he's going to be freaking out. So I got admitted. They hooked me up to the monitor and I had like 5 contractions pretty much back to back to back. So my body was just not happy. So they admitted me. I was started on magnesium, which I think somebody's talked about in previous episodes, but it's awful. They call it flu in a bag, and it literally is flu in a bag. Like, you're achy, you have a headache, you feel hot, you feel like you have the flu. But, you're going to do what you have to do to keep your baby safe. So I was on that for 24 hours straight, and then my contractions pretty much stopped. So they stopped the magnesium and just watched me, I think for like another 12 hours maybe.
Is the science behind the magnesium, that's just to relax the muscle, right? To prevent the contractions from continuing?
Yeah, so your uterus is like a smooth muscle. And so magnesium is shown to really help that and relax that. You give magnesium for a lot of other reasons, but that's one of the reasons. And then when I stopped my magnesium, they started me on ibuprofen, which we all know is always a no-no during pregnancy. And that's just because it can obviously decrease your clotting and other reasons. But that, again, is a anti-inflammatory, and it works on the smooth muscle. And so they started me on ibuprofen. I was on that, I think, every 8 hours around the clock at home. And so that actually, I think I ended up having one contraction every day. So it really helped and it was able to get me home. And then I was kind of on like a bed rest, modified
What
activity.
caused the episode at the hospital? Like, do you know what caused the extreme amount of pain and your reaction?
I think it was my cervix was dilated and thinned out, like what my high risk doctor had kind of explained to me. He came and saw me when I was in the hospital. Um, and he said, I think my cervix was just really irritated and really angry, and they have to, he tightens it. And I mean, I remember feeling it tighten, and it was just immediate. Um, yeah. So, he kind of had said it happens. It's obviously a rare thing, but I think my cervix was just so irritated. And he was like, at this point in time, we just need to get these contractions to stop and get you to kind of your body to relax and hope that it will stop and I don't go into labor. Because here I am, 20, I think I was almost 23 weeks when I had my surgery, and they don't do the stitch placement after 24 weeks because the babies are viable. So if they're in there and they, are putting the stitch, I mean, they're right by your water, like your sac, right? So I mean, if they're in there and they poke it and break your water, like you're having a baby. And so I think it was a really high risk thing. I mean, I really had very not very much time to get it done. So it kind of became an emergent thing. So I went home, was on modified rest. With starting the ibuprofen, I had weekly ultrasounds, and they actually did fetal echoes every week, which is one of the most insane things. Like, I've seen echoes done on a regular heart, but to have echo done on my baby's heart that's inside my belly was just completely crazy to me. But ibuprofen can cause the narrowing of the PDA in the baby. So before a baby's born, a little bit of biology. The babies have a hole in their heart between their right and left atrium, that because the baby's blood flow is flowing through you and flowing through them, right? They're not regulating their own blood and their own oxygenation. And so that hole is there, so it kind of bypasses the bottom part of the heart. So when they're born, it's supposed to close up within, I think, 24 hours of birth. But you don't want that opening to close, obviously, sooner when they're inside of you. So that's one of the complications of being on ibuprofen. And so they had to do the echo to watch to make sure that hole wasn't closing. And then they also checked my fluid levels in my sac. So I had to do that every week. Week 2, the PDA was narrowing, fluid levels were dropping. So I was like, I can't catch a break. I literally told my OB, every time I come in here, I feel like you tell me this is a really small chance that this is really going to happen, and then it happens to me.
And that happens.
It happens. So then I had to stop the ibuprofen, which was doing a great job of controlling my contractions. So then he started me on nifedipine, which is a blood pressure medication, but also can help to relax the smooth muscles. But it didn't help, and it didn't work as well. I think I was still having several contractions a day. I remember I had a contraction counter, like a note on my phone that I was keeping track of. And I was told that if I had more than 5 in an hour, I had to go in, because then they had to monitor me and make sure I wasn't going into labor. The nifedipine also caused really bad migraines. So I was, for like the first week I was on it, I was like in bed, just miserable and contracting. So I did okay, and I was home. I ended up stopping working, I think, like at 28 weeks. So I think I only went 3 more weeks at work. It was just too hard. I was on my feet. I was contracting a lot more when I was up working. They had me doing like desk work for like the last week. And then my OB was like, it's not really worth it. Like, we're not going to risk this baby coming because you're working. So I stopped, went on short-term disability. I remember doing a lot of crafts for the nursery. Did a lot of the nursery design, because at that point I'm like, we got to get this nursery ready. So I did okay. And then 31 weeks, I woke up and I was having a lot of cramping and a lot of increasing contractions again. So I went to the hospital. And I had had 5 contractions in an hour while I was in triage. So they gave me steroids to try to mature my daughter's lungs in this anticipation that I was going to be going into labor. So I did that. I was at triage for a couple hours. They've sent me home. I went back the next day, got the second dose of steroids. They monitored me. I don't think I had very many contractions while I was there. And then I followed up with my OB the next day, and she's like, I'm going to just check your cervix. I just want to see like if we've had any activity. And I was 1 centimeter. She couldn't tell how thin I was because I had the stitch, so there was no way to go past like the outside part. But here I end up buying myself another admission to the hospital. My high-risk doctor told me that I couldn't go beyond 2 centimeters with the stitch because it could cause a lot more problems. I mean, it's holding it closed, right? So like if you're putting a lot of pressure and it's trying to dilate, it could. I mean, he was like, it could tear your cervix, and like then you're
right.
you're not going to be able to have any more babies.
Can your water still break when it's stitched?
Yeah.
Okay.
Yeah, because it's still opened. I mean, it's not fully closed. It's just holding it tight so that it's not just going to be able to open and thin out on its own. So I ended up starting another dose of magnesium. I was like, this is awful. Like I knew what I was getting myself into that time. But it's not fun. So I got admitted for magnesium. They monitored me. I think I was actually on the magnesium for 36 hours that time, just kind of continuous. Yeah. And then they stopped it. I don't honestly even know if they can do it longer than that.
I have another question. I don't know if you can answer this, but with all the medications that you were on, the ibuprofen, the high blood pressure medication, is there ever a situation where they would just prescribe you low dose magnesium, or in that situation, is it not strong enough? Like a magnesium supplement?
Yeah, I don't think it's strong enough. I think that they probably would have if it really would have helped, but I mean, this is super strong. I mean, I think it's like probably 20 grams, I think, per bag. And I think, 20 grams, which would be like 20,000 milligrams. And I think like a magnesium tablet's like 200 milligrams. So you're getting a lot higher dose. And I had a lot of bags that they kept switching out. So I was on that, I think, for about 36 hours. And then I remember I think I had stopped magnesium. I was back on the nifedipine. They're like, let's just monitor you and see if your contractions, because my contractions had stopped on the magnesium. Let's see, make sure that they stop and they don't come back. And I remember it being 4 o'clock in the morning, and I had just all of a sudden just back to back to back to back contractions. And so I became, me being a nurse and working in a hospital, I became the patient that they were worried about, and I had about 10 people in my room. So they had given me a medication that was a shot. And it's called terbutaline, and it's black boxed meaning that they don't prescribe it and they don't recommend it. It used to be the drug that they would use for contractions, but I think it causes a lot of issues with the women that are pregnant. So they gave it to me, and my heart rate was like 220. My heart was beating out of my chest. I'm sitting there in the room by myself. I mean, they were checking on me, but I was essentially alone. And I'm like, I feel like I'm going to die. I don't think I'm going to make it out of this room. And it didn't last forever. I think it was like maybe a couple minutes, but it was scary.
What was your mental health like at this point?
I think that, having a loss, I was obviously super grateful for at least, at this point, if my baby's born, we're 31. I think I was almost 32 weeks pregnant, right? So like my doctor kind of told me 30 weeks is like we're going to be in such a good spot. She's had the steroids. We are, we're doing everything we can. Yeah, she'll end up having to go to the NICU, but we're not in the 20 weeks situation that we were in a few weeks before. And I just remember telling myself every week I would go in and see my doctor. I'm like, we made it one more week. we're 1 week less that I'm going to potentially have a baby that's in the NICU, right? So you're just like counting down and you're celebrating every little win that you had. But I mean, it was hard, and I think like it was scary, and I'm in the medical field, so I know a lot more, and I couldn't imagine somebody that doesn't have that background having to go through it, because I knew a lot of what they were talking about. I knew a lot of the risks. But I also knew the reality, especially being a pediatric nurse. Like, if I have my baby right now, they're going to be okay. You know, they're not hopefully going to have long-term problems. They're going to be healthy. They just won't be able to come home with me. So I had kind of set myself up for that. The neonatal team had come and met with me when I was in the hospital and kind of had said, you know, if the baby's born now, this is what we're looking at. Hopefully you've had the steroids, and we've given the steroids a few days to really kick in, that, you know, her lungs will hopefully be more developed than they should be, which would have helped, which I appreciated. I appreciated having the reality given to me. I didn't really want them to sugarcoat it. I wanted them to be real and tell me what it was really going to be and what was going to happen.
So
I got that
speaking
in.
of people that don't have a medical background, how was Tyler throughout all this? Like,
Yeah,
how's he handling it?
He came to the doctor's appointments, and I kind of made him, because it's really hard to explain things, because I don't know 100% everything they're saying, but I know the medical terminology, right? So I knew a lot more of what was going on, and I tried to explain it, but I think he just always took it better hearing it directly from the doctor, not me. But I mean, it was hard. It was scary. I think we were both just really not sure what was going to happen. And, you know, we had our moments that we kind of were like, this might be our only child, and that's fine. You know, you don't obviously want to be selfish and be like, I'm going to have another baby and put my child through that if it really is something. But, I mean, it's hard. It's not an easy thing to go through as the person, and obviously as the spouse and the family, and everybody was super worried. And it was the first grandchild, so we had a lot of people sending lots of messages and coming and visiting, and I had a lot of home cooked meals, because then I actually ended up going home later that day. The OB that was on came in and checked me, because I think the nurse, with all of that happening, my nurse had checked me, and she's like, you're 1.5 centimeters, which means that I dilated more. So I was like, this is it. Like, they're going to have to take the stitch out, and I'm having this baby. Like, I'm not going home. And then the on-call OB that next day came in and checked, and she said, I think you're pretty much still 1 centimeter. So I kind of learned it's very subjective, especially when you're that not very dilated very much.
It's kind of wild. You would think a measurement is a measurement.
Yeah, they do it. I will say I did do my OB stuff in nursing, but I have never worked in OB. But it's always like a fingertip. And so if you think about it, people's fingers are all different sizes. So if you're talking about like, well, you know, it might be like 2 fingertips, and it might be one of somebody else's. So I can see that the technical measuring, that's really what it is. You learn to measure by fingertips, if you guys ever wanted to know. That's what they're doing when they're checking you.
Yeah, I never knew how they could tell. She's like, oh yeah, you feel like a 1. And I'm like, okay, whatever you say.
Yeah. I just remember being so nervous every single time they checked me. I'm like, I'm going to be a 2. They're going to have to take this stitch out. Like, every week I went in for follow-up. I saw my OB once a week. And then I was getting twice a week ultrasounds, the BPPs, where they check the baby's movement, their breathing, their heart rate, and I think your fluid levels, and they give you a score. And as long as your score is above whatever it's supposed to be, you're fine. If it's not, then you're kind of at risk of delivering. So I went home, was on strict bed rest. This was...
Were you were still on the high blood pressure medication during this time?
Yeah. So ibuprofen, if I would have still been on it, they have to stop it at 32 weeks, because I guess it doesn't work as well at that point when the baby's that big. And I think there's just more risks to it. And then also, you don't really want to be on a blood thinner when you're getting closer to delivery. So I was on the nifedipine up until I delivered. So a few weeks goes by, everything was going good. Having a few contractions here and there, but I never had to go back to triage. I just had my weekly appointments. And then I was scheduled to have my cerclage removed at 36 weeks because they remove it. And then they essentially want your body to then, at that point, naturally go into labor. My OB had said usually 50% of the people will have the baby within a week. The other 50% will make it to their due date or even go past their due date. So I was kind of in this 50-50. And that was just done in the office. That again was just, that was nothing compared to what I had been through with getting it inserted. But it's, again, just kind of like a pap smear. And they just cut it out and pull it out. And it's literally a string because I wanted to see what it looked like. So then I was on nifedipine, but my blood pressure was high because I think my body was just stressed and it was over it and I was over it. I remember posting on Instagram and I'm like, I'm getting my stitch out and I am okay if this baby decides to come. Like, we've made it this far. We have steroids on board. I'm done. And 2 days later, I woke up. Backtrack. So the day after, I had a follow-up in my OB office. So they checked me, and I was 4 centimeters and 90% effaced. So basically, my uterus my cervix just popped open. That stitch was holding it, and the stitch was removed. And so the doctor was like, I don't think you're going to make it a couple more days. But my blood pressure had been high. So he said, if you do make it to 37 weeks, we need to induce you because your body's just been through so much. I don't want it to cause more issues after delivery. So here we were, okay, if we make it 6 more days, we're going to have this baby or it's going to come sooner than that. So the next day I woke up, was having the cramping and contractions that I had in the past. Called triage. Obviously, they tell me to go in. I go in, and I think I was 5 centimeters. And I was having not consistent contractions. Actually, to the point that the doctor that was on didn't want to admit me because I didn't progress past 5 centimeters the hour that I was at in triage. So I think that that's a lot of the threshold is if you're not really progressing and they're like, you're in early labor, you need to go home. My doctor and the triage nurse was like, I'm not going to let you go home because I'm worried that if your water breaks, you're going to have this baby in the car. Just because my labor had progressed already so fast. So she kept me another hour, and I remember she checked me again, and she's like, I'm going to say you're 6 centimeters, and called the doctor. So again, I'm preterm, so I'm only 36 and 3 days pregnant. And my OB office is a big office, and they work where they have a different doctor on every 24 hours. So my OB was not on, but she always was so great when I was in the hospital. She would always take me on, and she would always admit me and monitor me and see me all the way through, which was really nice. I think she was on vacation, or she was studying. Maybe she was taking her boards. She was doing something. I remember her telling me, and I'm like, you really shouldn't be picking this week out of all weeks to be taking your exam, but obviously I understood. So the doctor that was on the day that I got admitted, which was Friday the 13th and a full moon. And me being a nurse, those are the 2 most superstitious days and the 2 days that we don't want to be working. And the fact that they fell on the same day was really wild. So the OB that was on had said, you're preterm. We'll admit you and we'll monitor you, but we're not going to induce. We're not going to, start the process of your body has to do it on its own. And so I remember like lunging and squatting, and I was walking the halls. I had been on bed rest for 5 weeks, and I was cleared at 36 weeks that I didn't have to be on the activity restrictions. I was like, I'm doing whatever I can to progress this labor. So I think the next morning, I remember I had a ton of contractions overnight. I was really uncomfortable, couldn't sleep. I had asked at one point, like, can I get an epidural? Because I really just want to be able to sleep. If this is going to progress and turn into me going into labor, I would love to have the sleep. And the doctor that was on, the same one, had said, if you don't progress any further than what you are, we're going to transfer you to antepartum because you're preterm. And she's like, and you can't have an epidural in antepartum. And I remember being like, but if I'm in enough pain and I'm uncomfortable enough that I'm asking for it, maybe I really am in labor. So anyways, I that night had I'd never really had consistent, they say contractions 5 minutes apart for 1 hour, a minute, whatever the rule is, the 5-1-1 rule. I never really had that. My contractions were all pretty sporadic most of the time. So that next morning, my nurse had came in, and it was the same nurse that I had in triage the day before. And so she checked me, and I was 7 centimeters. And she's like, I'm calling the doctor. Do you want me to call anesthesia? She's like, you're at the point that they're not going to transfer you. Like, you're in active labor at this point. And so I said, yes. So anesthesia came, gave me the epidural. And I had been contracting since I was 23 weeks pregnant. So for 13 weeks, I was having inconsistent but consistent contractions for, essentially 3 months. I was done. So the doctor that was on that next day came in, and he's like, we're having a baby today. And I just remember both me and my husband were like, we like this matter of fact, precise, like, let's get this show on the road and let's make this happen. And so he had planned on breaking my water, but he had a C-section that he had to do. So he's like, I'm not going to do it until I know the C-section's done, because I know you're going to progress fast and I don't want to be stuck in the OR. So I don't even remember. I remember it was probably maybe 2:30. He broke my water, and I 40 minutes later progressed to the point that I was able to start pushing. And then my daughter came out like 3 pushes later.
Wow.
She was ready.
3 and done. That's nice.
Yeah. So I know. I mean, after everything I had that first pregnancy, it was really nice to know that once my body was able to do what it wanted to do essentially the entire time, like, it was pretty quick. But she was 4 pounds 9 ounces, so tiny, tiny. And I remember thinking, okay, I'm 36 and a half weeks, right? I'm still technically preterm. Are they going to let me take this baby home, or is she going to have to stay? And it kind of came down to the pediatrician that came and saw us. My blood pressure was still high. So thankfully I was able to stay in the hospital an extra day after I had her. Because if I would have been discharged home the next day, she wouldn't have come home with me. The doctor made that really clear. She wasn't eating. She wasn't latching. She was just so small. So I was trying to supplement with formula. I was just trying to get her to eat. I was syringe feeding her drops, whatever I could get her to eat. And I remember just like I was so excited when it'd be like 5 mLs. Look I'm feeding her. She's eating. We can do this. And the doctor that let us go home and discharged us 2 days after I had her had said to me, like, you're a pediatric nurse. I know you're not going to starve her. Like, if she struggles, you're going to bring her back. And I said, yeah, I mean, if I have to put a tube down her to feed her, I'll do whatever I have to do. I just didn't want her to be at the hospital. So thankfully we came home. I exclusively pumped for the first 10, 11 weeks. She just really couldn't figure it out. And then it was just like a light switch clicked on one day. Because we did practicing. I had lactation come to the house. We did all the things, all the tricks that she told us. And she just figured it out one day. So we were able to do kind of both combination. So I think 2 weeks after I got her to start breastfeeding, I went back to work. So then it was kind of a blessing in disguise because she was able to take a bottle and I didn't have to worry about that because I know that that can be a big stress. I know a lot of friends that have really struggled with kids that, don't take a bottle. They breastfeed the entire time their mom's off, and then it's a big stressor to try to do that transition and go back to work. So at least we didn't have that issue. So that's my daughter. She came in guns blazing, and she's my Sour Patch Kid. She's still such a strong personality, and she's a fighter, and I can see now just like how strong she is and how she was able to just kind of push through and get us through it. And she's here, so it's great. So that's my first pregnancy, or my second, I guess.
That's amazing.
Yeah.
That's amazing. That's such a, like, man, I'm like excited for you. What an adventure.
It was an adventure. And then the thought of, are we going to do this again?
Mm-hmm.
Came up. And I really wanted to have another child. I think mentally I wanted to do it again because I wanted to prove to myself that it was going to be better the second time. I had met with my high risk doctor. I met with my OB, both of them. And I said, like, tell me straight if this is something that you recommend we try to do again. Or is it going to be worse after your body's already been through a pregnancy? You don't know what. And they both had said it's 100% safe. We know now what your problems are. And so now we know what we need to prevent, and we can intervene quicker to hopefully prevent, all of the issues that I had with my cervix from happening again.
Were they actually able to determine that there were complications with your cervix, like going into it, that it wasn't the pregnancy that caused like your cervix to thin or stretch or anything like that?
Yeah, I don't honestly know if there's any way for them to really know, because I think
Yeah.
once you have the baby and your uterus shrinks back down to the normal size, I don't think there's any way for them to test and see. Other than looking, they obviously assumed that I had scar tissue built up.
When I also had the LEAP procedure, my doctor, I asked, because it was like way before I was thinking about having kids, I said, is there any risk? She told me, which I don't know, this is just one doctor, said that one of the major risk, but it's not that common for you to not go full term after a LEAP procedure. So that's what I was always worried about, like if I wouldn't go full term,
Yeah.
which I went past my due date. But I do have a friend who also had a LEAP procedure, and she went 2 weeks early with both her kids. And so, but because she had it done twice. So I don't know if that would have had anything to do with it, or just a perspective. I don't know what one doctor said.
Yeah. I mean, I was always told that there was a risk of having scar tissue and having my cervix be a little bit weaker because of the LEAP procedure. But again, I was in college. I think I was 19. I was so far away from having kids. And of course, I'm thinking in my mind, like, if I have abnormal cells, like, I got to get them out, right? Like, you don't want to, you're thinking about worse things than having a baby at that point in time. So, looking back, is that what I had to do, or could I have done something different to maybe prevent this from happening? I don't know, but
No, you can't think like that, because
no, you can't. But it's easy to kind of go down that rabbit hole, right? You're like,
I was going to ask, are you at peace with how that all went? Like, we've talked in the past, like I still am not totally at peace with my first daughter, like having to have a C-section. Like, could I've done anything different? Like, are you at peace with it?
Yeah. I mean,
Good.
I think I still definitely have a little bit of trauma from that. I remember just, you're always going to worry, and you're always going to, is it something that I did? Did I cause this? But I mean, honestly, my daughter is 100% healthy, and there's nothing wrong. And she was small, and she's still small. I mean, she's 12th percentile, and she's just rocking it, and she's on her own growth chart, and her doctor's never been concerned. Emotionally, she's totally fine. She was only born a couple weeks early, and you think about babies that are born super early, that's still have a completely normal, healthy life. So it just makes you like really be grateful that modern medicine and doctors that are so smart and know. And my OB, we moved about 30 minutes away from where we were living when I got pregnant with my daughter, and I stayed with the same OB. I'm like, I'm not moving to anybody different. She knows me. She's just such an amazing person. The fact that she came and saw me every time I was in the hospital, she wasn't on call. She had 2 boys of her own. Like, she had a life outside of being a doctor. It's just like a testament. And we're not having any more kids, but if we ever did decide to have any more, I mean, I would, if she ever left and wasn't here, I'd be like, nope, I don't trust anybody else. Between her and my high risk doctor, they just worked so well together, and I trusted them, and I knew that what they told me, I never doubted it.
That is so awesome to hear, with how much we talk about how much we doubt our doctors.
Yeah.
It is so, so great to hear the other side of that, where you found some people that you're like, 100% trust you with my life. This is amazing.
Yeah.
Very cool.
Yeah. I mean, I guess it's the perks of living in a big city, but the problem with that too is there's so many doctors, right? And you get recommendations, and all the people that I had been recommended weren't covered by my insurance. And so then I kind of just went in blind, and I found this doctor's office, and I had, scheduled like a annual exam with a doctor and and then I found out that it was a male, and I freaked out. I was like, I don't know. I just have always been kind of weirded out by like male OBs. It just wasn't my thing. So I called back, and I'm like, I'm really sorry, but can I request a female doctor? And they scheduled me with this doctor who's now my OB. So it's just like, it kind of worked out. The doctor that I actually switched from is the doctor that actually delivered my daughter. So it's just funny, full circle. Like, he was really cool and very matter of fact. We had a football game on the TV, and he's like, this is the place to be. Like, he was just very cool. And my husband loved him because he was very matter of fact. I need the emotions. Like, I need a doctor that's going to be like, I feel you. I'm going to sit here with you and cry with you and do all the things and give you the time that you need. And he's like, I just want you to tell me straight and then get out, So it was funny, the perspective. The doctor that delivered my daughter was fine, but he wasn't, the one that I would have preferred to be seeing every time. But my husband really liked him, so it was just funny. But so fast forward, we actually, I think, Danielle, were going to your guys' wedding. So traveling on our East Coast trip, remember? We did like the 10-day trip up the East Coast, went to your guys' wedding, and went all the way up to Maine. And I remember we had talked, like, when we get back from this trip, let's start trying to have another baby. So it's just funny. That's like my mental timeline in my head. Like, it started.
How old was your daughter at this point?
She was 18 months.
Okay.
So in my mind, I always wanted to have 2 kids. I always wanted my kids to be 2 years apart. I didn't care if it was a girl, boy, girl. I didn't really care, but that was just always in my head my entire life. I'm going to have 2 kids. They're going to be 2 years apart. We're going to be done, and that's going to be it. So that was what I was, of course, planning on. So we had a toddler. So we all know just that you can't plan your life as well as you can plan before you have kids. Especially when you have a toddler running around the house, and the unpredictability. Our daughter was a terrible sleeper, so we spent many a night in her room and not on her own. So it took us 9 months to get pregnant after my daughter. And again, I was considered high risk at this point. So I did the beta HCGs 48 hours apart. My levels had tripled. Everything looked great. Had an ultrasound at 6 weeks, saw the heartbeat. Things were great. My doctor said, I'll see you in 2 weeks for your 8-week appointment. Show up at my 8-week appointment, no heartbeat. So I'm like, I just tried for 9 months. Again, 8-week appointment. I'm going into that appointment. And I will tell you, I had suggested after this point, like, OB offices need to have a separate waiting room for women that are not pregnant. And I'm sure, like, mean, anybody that's gone through infertility, like going to a doctor's office and seeing all those women that are like have these big baby bumps and they're waiting in the waiting room, and you're sitting here like, I am literally losing a baby right now. It's just really, that's like my one suggestion that I could have ever suggested to them, and they would never do it, but it's hard. So anyways, I'm at my 8-week appointment. There's no heartbeat. So my doctor did the ultrasound, and she said, when I knew, like she put, I was watching the ultrasound machine, and I knew the second that, because we had seen a heartbeat 2 weeks ago. I had been through this a couple times before. I knew as soon as she did the ultrasound and put, the wand in, that there was no heartbeat. And so she says, I don't see a heartbeat, but this machine is the bedside one. It's not as accurate. I want to send you to an actual ultrasound room and have them confirm. So I get dressed, go into the ultrasound room. They do the ultrasound, same thing. The ultrasound tech can't tell me because they're not allowed to, because they're not a medical doctor. But I knew it. So she's like, I'll walk you back to your exam room. I'll let you get changed. I get changed, go back to my exam room, and my doctor's like, I'm so sorry. And I remember just losing it. Like, I broke down, and I'm like, I can't believe this is happening. And she's like, again, like I said, she's a saint. She sat there with me and just let me cry. And she's like, I'm really sorry. I wish that I had better news for you. And I had kind of sat there, and she said, I know you know your options. We've been down this road before. We can let your body naturally miscarry the baby. I think the baby was only measuring 7 weeks, so it more than likely happened, at the 7-week mark. So she said, you might start miscarrying the baby any day now. So you can kind of wait and see. We can do the pills, or you can go and get a D&C. And again, I wanted to do the D&C because I have already been through the pills. I know how hard it is. But I had my cervix issues with my daughter's pregnancy. So I'm looking out for the fact that my cervix is already having so many issues. I don't want to cause more problems. So I decided to do the pills because I didn't want to wait. Because my first pregnancy, I had to end up doing something to intervene. My body just didn't recognize that it was losing the pregnancy, and I just really wanted it to be done. I didn't want it to drag on. So I did the cytotech again. Same thing. My doctor had actually said, we can send off the fetal tissue if you can collect it, to see if there's something genetically that you guys have that's causing you to miscarry. And of course I wanted answers. So I tried, which that was awful. And then of course I thought I had gotten like a sample of tissue, and it wasn't. So they weren't even able to do the testing, because they can test for like genetic stuff with the baby. That's the reason why I'm miscarrying. Maybe we have something genetic that we need to get tested for. So then I went for my ultrasound a week later, and it confirmed that it worked. So that one was successful. I did not have to have a D&C at least that time. So that was good, just to have the closure, and to kind of just start moving on with the process. And it was the same thing. We could start trying.
What does that do to your hormones? Like when you go through that process of being pregnant, and then you take these pills, and then you're not, like, how, I can imagine it's just a total blender of a roller coaster.
Yeah, I mean, with this pregnancy, I remember at 7 weeks pregnant, like I remember being so nauseous, and I woke up one day and I'm like, I'm not nauseous anymore. And I think in my head, I was like, why am I not nauseous? Maybe it's just that I'm getting closer to the point that I am getting over the hump. But I remember saying in the back of my mind, like, why am I not nauseous? This is not a good sign, right? But I was like, I'm going to wait. I'm not going to call. I'm going to wait another week. I just saw a heartbeat last week. Why would there be a problem? But yeah, I mean, your HCG, your numbers aren't like crazy high. You obviously have the symptoms, but pretty early on, I think I was just emotionally just done and frustrated. And yeah, I mean, it's a roller coaster because it's like you want to be pregnant and you are, and then you're not. And then your body has to heal from that. And you have to be able to move on and process and all of that. So it was the same thing. We could start trying again after a cycle. We kind of went through the motions, and I remember it was right around Christmas. I had gotten what I thought was a period. So this was 9 months later. So this has already been a year and a half of us from trying.
And how like emotional, like toll did that take on you?
Yeah. Well, I mean, Danielle, because I know you've talked, like you get your hopes up every single month, right? Like especially when you're tracking and you know
Mm-hmm.
that you ovulated and you're like, oh, I think we hit our window. Like we all know the trying, and I was just so fixated on the ovulation strips. My cycles were kind of all over the place. And even after I had my daughter, I think they were maybe a little bit more regular, but still not, 14 days. It's not like a typical thing. They say 14 days, you ovulate. Like it's never that
Right.
way. And so you're tracking your symptoms. I was doing the temperatures. I was doing the ovulation sticks. Like it just becomes such a chore after a couple months.
Did you do any of the other old wives' tales, like certain positions or, eating certain things, drinking things, supplements, anything like that?
No, so I did do some research. I had started some supplements. Like I don't even remember. There's like CoQ10. I had asked, like, I had never had issues with my thyroid, but I've heard that like some people, when you are trying to conceive, your thyroid levels actually need to be higher than when they are normal, like the high end of normal. And so I remember asking my doctor, and the problem is they're like, until you've had 3 miscarriages, or 2 consecutive losses, they won't do any further testing. Insurance won't cover it. And then most fertility doctors won't see you until you've been trying for a year. And once you have a loss, the clock starts over. So I had a pregnancy. So I was able to get pregnant. I just wasn't able to sustain it. So it was kind of in this weird window because I had 2 miscarriages, but they weren't consecutive. And we had only been trying for 9 months. Then the clock starts over. So then 9 more months goes by. And I had what I thought was my period. I remember it being kind of lighter. Didn't really think anything of it. I've never had like implantation, bleeding, or spotting or any of that. And then I remember probably 10 days after that, I started bleeding again. I'm like, that's weird. Why am I bleeding? And so randomly, I was like, well, maybe I'm ovulating. I don't know. Like I just had my cycle. So I took an ovulation test and it was positive. And then I got thinking that I had heard that you could actually have a positive ovulation test if you're actually pregnant. And ovulation tests are so specific, like they have to be the exact darkness to be positive. And so I remember I took a couple of them, and they were positive. So I had a pregnancy test. I took it, and it was faintly positive. But I was like, in the back of my mind, I guarantee you this is a chemical pregnancy because my HCG level, like my line was so faint. And at that point in time, I would have been 2 weeks probably past my missed period, even though I don't know what it was. It must have been spotting or implantation bleeding that I had. And then I lost that pregnancy. That one was the easiest one for me to get through because I really didn't know I was pregnant. I thought that I had
What
had
is
a
a
period.
chemical pregnancy?
So it's kind of basically your body, you lose the pregnancy like 3 weeks. I mean, the baby just doesn't really implant. So it's like it implants, but doesn't fully implant. And then it kind of dissolves. So a lot of people will have a chemical pregnancy, and some people don't even know that they have it because it just ends up being like a period that's a couple weeks later than what they were anticipating. And, some people don't check right away. They wouldn't have even known that they were pregnant. So I remember I called my office again and I said, I think I'm having a miscarriage, like a chemical pregnancy. And so they did the beta HCGs again, and my levels were like very low with my first one. So I knew that that's what was happening. So I've had 3 different kinds of miscarriages, which is kind of wild.
How many different kinds are there?
Well, that might be all 3. I don't really know.
Okay. That's
I mean, obviously
wild.
they have miscarriages, like late miscarriages, right? So they have ones that happen a lot further into your pregnancy. These were all early, but yeah, it was never consistent, never the same. So now I've had my 3 miscarriages and my 2 consecutive. So then I was able to go and get like my hormone levels checked, insurance finally approved, getting my hormone levels checked. I had the full genetic panel drawn, and they ended up sending me to a fertility doctor at that point because I had had just lots of different things happening.
So you had mentioned your thyroid. When they checked your hormones, did they check your thyroid and notice anything that was off there?
So my thyroid level was fine. I had been following a lot of people that had infertility issues, especially like just social media. You find all sorts of different people when you're kind of in that community. And a couple people that had had secondary infertility, which is basically what I was kind of diagnosed with because I didn't have a problem getting pregnant the first time around with my daughter and the pregnancy before her. But, I'm like I was older at this point too. So you start getting into your 30s and it all goes downhill. But they checked my thyroid. My thyroid level was fine. I remember I went to the fertility doctor and I asked him, because they did all the blood work too. And I said, I've read that they say that your thyroid level should really be higher than what, the normal range is when you're trying to conceive. And, he had kind of said, yeah, I mean, that's kind of not really scientifically based. But he's like, it's not going to do anything and it's not going to hurt. And so he did put me on Synthroid, and then I was on vitamin D because vitamin D can also be an issue, which living in Phoenix, I get plenty of sun, and if as long as you have a well-balanced diet, like your vitamin D levels are usually pretty normal. So but I mean, I had a pill box full of stuff, all supplements, herbal stuff. I can't even remember what they were, that I was taking just to try to help anything. So they checked me, they checked my husband, we checked out, everything was perfectly fine. We had nothing genetic that could be, a rhyme or reason for this. And so my fertility doctor said, some people that have early losses have clotting that happens in like the capillaries of your uterus, like the tiny, tiny little blood vessels that could just be restricting blood flow enough to that baby that it's not getting what it needs early on. And so they started me on a baby aspirin, which I had heard some people that had gone through fertility stuff that they took baby aspirin. Yeah, I think it's probably a big part of the normal fertility workup and process. And I think it's just that they're trying to prevent anything from potentially causing an issue and preventing that baby from sticking. So I, did all the ultrasounds, and the fertility doctor had said, I'm going to recommend IVF. And I kind of just thought, I've gotten pregnant before. Like, I didn't really want to just jump right into that, even though we really wanted to have a baby. And so we agreed to just do, we did the ovulation or the stimulant meds. And then he watched and did the ultrasounds. And then I ended up doing the trigger shot to try to basically force myself to ovulate at a specific time to try to really pinpoint and time things perfectly. The problem with me is when you take those stimulants, it can increase your risk of having multiples. And I can't have a multiple pregnancy. Like my uterus and I just wouldn't have been able to sustain it. My doctors were like, it's too risky. We can't do it. So that's why he really wanted me to do IVF, because he said it's really hard for me to know exactly how many potential eggs you're going to release and the risk of potentially having twins or triplets or whatever. And so he had to watch me really close. And I had a couple cycles that I had too many follicles that matured, that he was like, it's too risky for us to try with this cycle.
So were you doing medicated cycles or were you doing IUI at this point?
No, I was doing medicated cycles.
Okay.
Yeah. Our next step was going to be IUI, but we really just wanted to try the medicated cycles just to see if we could somehow just get my body to regulate. And then with all the supplements and all the extra ultrasounds and watching, maybe, we were like, maybe the baby aspirin will help. Like once I get pregnant, maybe that'll keep me from miscarrying. So I had done Clomid to begin with. And I think that was the one that, I felt like, you feel like you're 6 months pregnant. You're so bloated. You're awful.
It's so awful.
And I had a ton of follicles with those 2 cycles. And so he ended up switching me to Femara because he's like, you're responding too well to Clomid and I can't go down on your dose. So then we did Femara and I did 3 rounds of that with the trigger shot. And then, after that 5th round, when it didn't work, I was like, I'm done. Like we just kind of threw in the towel. I'm like, you know what? Maybe we're just not meant to have another baby. We have our daughter. We're grateful for that. This was also 2020, heart of COVID. I know you guys have all talked about that. Like it was hard. You have to go to the doctor's office by yourself. You're wearing a mask. Like every time you're going, it's just a risk of potentially catching something and just the extra stress of that. So I decided I was going to take a break and literally took a break, didn't track, did no testing, and ended up getting pregnant, which was wild. And I really didn't believe it because after everything we had been through, that was the way we were going to get pregnant. But
that is wild how things work like that sometimes.
Yeah. And I remember I found out I was pregnant and I hadn't seen my OB in over a year. And so I'm like, who do I call? Like I've been seeing my fertility doctor, but I didn't do a medicated cycle that round. So I was kind of in this, do I call my OB? Do I call him? So I ended up calling the office and they were like, 100%, we'll get you in. We'll do the blood work. So they did the HCGs. And then they actually continued to do them until my level was at a certain number. And then they brought me in for an ultrasound. So that was really nice. Like I had blood draws every couple days just to check. A lot closer monitoring than what I had at my OB office, which is more monitoring than normal people get. So I was grateful for everything. But, and then I went to my OB office at 8 weeks and I just remember she's like, we did it. I'm like, we did. Like, we got to get this pregnancy to continue on, but we made it past the 8 weeks. That was always kind of my time. That was really stressful and hard. So I ended up getting a preventative cerclage at 12 weeks pregnant. I think I was actually probably close to 13. They don't like to do it until you're past the first trimester because then your risk of miscarrying is so much less at that point that he's like, I don't want to put a stitch in and then, have it cause or have the pregnancy not last. So, and that was so much easier. I think my uterus was just small and not strained. My cervix wasn't strained. So it was the way it was supposed to be, where they tightened my stitch and I cramped for a little bit and then it was gone. And I remember being in recovery and I'm like, that was it. This is how it was supposed to be. So I still had ultrasounds a little bit more frequently than normal just because of the cerclage. They kept checking my cervical length with it in just to make sure that it was staying long. And then at 18 weeks, I started contracting. It's just clockwork. My body doesn't like being pregnant. So started contracting. So here I go again, back to ibuprofen, back to the echoes, checking my fluid levels, checking the PDA of the heart. And everything went great. I was able to stay on the ibuprofen. I never had to stop it. They ended up spacing me where I think I was doing every 2-week echoes. But I ended up stopping. I went on light duty right when I started contracting at 19 weeks because I didn't want to risk anything. And then I was working for Banner at the time, and they were only allowed you to be on late duty for 2 months. So I ended up stopping working at 26 weeks. So then I was just sitting around at home. And then I think I did end up going to triage around that time. Like I just had a burst of contractions and things kind of sped up. And so they ended up adding, ended up adding nifedipine, or they just increased my ibuprofen dose because everything was going okay. And then the plan was for me to stop ibuprofen at 32 weeks. So everything was going good. I had contractions. I was tracking them. I never had, a ton that caused me to ever go into the hospital. I never had to be admitted. I was cruising right along. I was so excited. And then my body decides at 31 weeks that it likes to just be difficult. I was leaving my parents' house. I had just dropped my daughter off. I think I was going to get my hair done. And I walked into my parents' garage and I slipped on a rug and fell. And yeah, you're like, you know what's coming because you reminded me of this last night. I mean, I wasn't, but so I slipped on a rug, fell on my butt because of course I'm pregnant. I can't fall forward. And I broke my tib fib. So my lower leg right above my ankle all the way through. Spiral fracture, like really bad trauma. My bone was like in 4 different pieces. And I think, honestly, I remember it happened so fast, but I think I was so worried about falling forward that I sat down like as I was slipping, and my foot was underneath me, and I must have just been the impact or whatever. I remember like I didn't think I really broke it. It wasn't immediate to me. I remember trying to stand up and I couldn't stand up. I'm like, okay, I probably just twisted my ankle. I called my mom. I hear her running through the house like she's freaking out because of course I'm like, Mom, I fell. So she comes running, loads me up into the car. My husband was actually painting the nursery at the house. And so he met us at the hospital. And they did an x-ray. And yeah, so I broke my tibia all the way through and then my fibula almost all the way through. So I got admitted to the hospital again.
So you said it wasn't immediate that you felt it, like you thought maybe you sprained your ankle. But when you were in the car driving to the hospital, like did the pain start to sit in?
Not really. I mean, my foot was pretty swollen, but I wasn't in like a ton of pain. And I think it's because that break was right above my ankle and my foot was relaxed down where it wasn't like up. I wasn't putting any pressure on my bone. But I went to the ER and I said, like, obviously I'm pregnant. I just fell. And I, of course, and mentally the whole way to the ER, can I feel my baby moving? And of course I'm like, I don't know if I felt it move. Like I'm all fixated on my leg and then I'm fixated on my belly. And so I remember telling them like, I don't want anything for my leg. I just want to go to triage. I want to make sure my baby's okay. And so they took me up to triage, hooked me up. Everything was fine. They watched me for probably 30, 45 minutes. I wasn't having any contractions. Heartbeat was fine. He was moving around. Everything was fine. So they sent me back down to the ER. To finally get my x-ray. And so then I found out that I broke it, and the results popped up in my like portal because I had the portal from being in the hospital so many times. And so it's like the results, and my my husband was like, there's no way you broke it because I wasn't like screaming in pain. I wasn't dying. I was uncomfortable, but I was okay. And so I pulled up my results and I'm like, I broke my leg. And he's like, I can't believe you broke your leg. Like, you're sitting here totally fine. I would be screaming. I'd be like cussing. I'd be yelling. I'd be so angry. And I was in like a stretcher in the hallway because again, it was 2021. So it was still COVID times. So like, ER beds are hard to come by. And so they came to splint me and I was in the hallway. And I remember they asked me, do you want any pain meds before we do this? I'm like, I don't want anything. Like, I have a baby in my belly. I'm okay. Like, just split me. And that was awful because they had to put my foot at a 90-degree angle. So it put all of the pressure on my bones. And I just was like, okay, now I want all the pain meds. And I got admitted to just like the ortho floor, which they didn't know what to do with me. I mean, the doctors were like, I'll order you Tylenol because they didn't want to order me anything strong. knowing that I was pregnant. And so again, my OB came. I don't know how she found out. I think they must have consulted the team, and she somehow must have gotten the notice that I had been admitted. And she showed up to my room and she's like, "You really cannot stay away." I'm like, "I know, but it's not pregnancy related this time." But she ended up, ordering, and she's like, "I'm going to order pain meds, and you tell them, like, if I order it as frequently as I order it, you can have it that frequently." So that was nice, knowing that, they were giving me basically the blessing to get whatever pain meds I needed. She's like, he's born in the next couple of days because your body's under stress. That's obviously a risk that we take at this point. He might withdraw from the meds that you're taking, but it's not going to be terrible. He'll be okay. So I was every 2 hours asking for my pain meds, wanting my pain meds all night. So they took me to surgery, and I had to have surgery awake because, again, I was pregnant. No. Because it was too risky to put me under anesthesia when I was that pregnant. So I had a spinal epidural, and I was awake, and I had been up all night. And so I think that they did give me something to kind of relax me. And I did fall asleep for probably the first hour, but I remember I was in the OR for 3 hours.
That's a long surgery.
It's long. The surgeon told me it was probably only going to be an hour and a half, but once my bones were like broken into like 4 different pieces on the end. And so she was like a trauma doctor. She's basically pieced everything back together. And I have 3 plates now and like 25 screws in those bones. So I had to feel and hear just
and
like
smell and
yes.
That's a thing. Yeah. Orthopedic surgeons, it's like being in a workshop.
Yes.
Yeah. You get to hear the grinding and the screwing and the hammering. Yeah.
They have drills, they have hammers, and you're awake and you can feel it. And
oh my gosh.
Thankfully it wasn't any pain, but it was wild. You
feel the tugging and the moving.
Yes.
And yeah.
I just got chills.
So then I was admitted for steroids again, because they were like, your body's under stress. There's a good chance that you might go into labor. So we're going to do the steroids just to prevent, mature his lungs if that's what happens. They ended up transferring me to the antepartum unit, which was nice, because then they were able to monitor him a little bit closer. And I think I was there for 2 days for just pain control. And then I was non-weight bearing for 8 weeks. So that was hard because I had doctor's appointments twice a week for my pregnancy. Because again, I was doing the monitoring with the ultrasounds. And then I had I think weekly appointments with my orthopedic doctor. So, and I couldn't bring my daughter to appointments because it was COVID. So I had to have somebody with her. And then I had to have somebody with me. So it was hard. That was really hard mentally because I was like, I can't be a mom. I can't be a mom to my child that I have. I can't take care of myself. I can't get myself to appointments. How am I going to take care of this baby that's in my belly that I'm still going to be non-weight bearing for? So that was really hard. But we did it. I had a wheelchair and a walker, and I felt like I was 90 years old. And I was parking in the handicap parking spots and taking full advantage of being able to be close for my doctor's appointments. But my high-risk doctor was out of the office 36 weeks, so we had scheduled my stitch to be removed at 37. And he actually said after I had broke my leg, we need to give your body 1 more week because you just need to get over this hump too. So that was nice. I had it removed at 37 weeks. And then 3 days later, like clockwork, my son decided he was ready and I went into labor. So I never made it to term with either one of my kids. My son was 37 weeks, but I never made it all the way to my due date. My body just doesn't like being pregnant, apparently. So that was a pretty easy, straightforward labor too, thankfully. And he was 5 pounds, 10 ounces. So I had 2 little babies. But that's it.
Wow.
And your son is all healthy and happy
all
now?
Healthy. Yeah. He's struggled with speech. they say boys are a little bit slower to develop with that. But he was in speech therapy. Actually, through the state, it's free until 3. And I wish I would have taken advantage sooner. We didn't really get him started until he was almost 2.5. So we phased out a few weeks ago, but he's easier. I mean, he's healthy, but he is now able to get his point across a little bit easier. So he doesn't get as frustrated. We had our moments where he just couldn't get out what he wanted, but he 100% acknowledged it and knew what he was trying to, get out. So, but it's better. He copies everything you say now, and he has glasses.
He's so cute.
Have to follow me on Instagram, but he has cute little blue glasses, and he loves them, and he asks for them all the time. They do a vision screen at 2. I don't know if you guys have, I guess Danielle and Leah, you guys haven't done that yet, but Lisa, I don't know if you remember that with your daughter. They do like a vision screen. And he failed, but he was very uncooperative. And I really thought he failed because he had his eyes clenched shut. How did they even know that he had bad vision? But I was in glasses when I was in kindergarten, and I had a pretty significant lazy eye and stigmatism by that point. And so I think that my vision was probably bad a lot sooner. They just didn't do early screening when we were younger. And so since I told his pediatrician that, she's like, let's just send you to ophthalmology just to check. And they dilated his eyes. And again, he had his eyes clenched shut. He screamed the whole time. I don't know how this doctor was even able to tell that he couldn't see, but he failed on the same eye that he failed in the pediatrician's office, which is the same eye that I had my issues with. So our goal is he's in glasses now full time, and they'll dilate his eyes like every 9 months and then make adjustments. And hopefully his eye won't get worse. I think his vision's okay. It's just he basically has kind of a lazy eye where the brain's not communicating to that eye to work as hard as the left one is. So now the left one's going to pick up the slack. That's what happened with me. And then my right eye just kind of stopped. Like I really don't see well out of my right eye at all. So I thought there was no way he was going to keep the glasses on. Even Tyler was like, there's no way this is going to work. I mean, he ripped them off. I had to hold him on his eyes and hold his arms down, and we would try to like watch Coco Melon on TV for 5 minutes, and then I'd give him a break. And then probably 3 days later, he would keep him on for longer periods of time, and then we would take him off and give breaks. And then now it's full time. He wakes up, and the first thing he says is "glah glah." He needs his glasses, and he puts them on himself, and so it's cute. But
that's cute. Yeah, I wonder. I mean, I didn't get glasses until I was 14 or something like that. But the more I wore them, the more like there was one day I walked outside to go drive my car, and I was like, I can't see anymore, so I need to wear my glasses.
So you guys had your 2 kids. They're happy and healthy. You only wanted 2 kids, and you guys were done. Both of you were on the same page with that.
Yep. Yeah. I'm content with 2. It's nice having a girl and a boy. We've been able to kind of experience both sides of it. And then, our kids are 4 years apart, 4 years and 4 months, I guess, so almost 4.5 years apart. And I really was like, I don't want my kids to be that far apart in age. I felt like I was completely starting over, but my daughter has understood from day one that, there's going to be a baby. She was so excited. The day he came home, she just has lit up, and she's so helpful, and he loves her, and they just have such an amazing relationship. It's really cool to see. And she just is older, and she understands that, I have to give him attention because he's young and he can't do these things on his own. And now he wants her to help him with everything. We're working on potty training, and I told her that this summer she might have to help me potty train him because he'll go and sit on the potty if she's in there. I'm like, you're just going to have to sit on the toilet a lot this summer to help get him motivated. But
That's
so,
sweet.
Yeah, they're like really, really great friends. And I was just worried about the age gap. But, she's been super social. She's got so many friends. And she, of course, I think every girl always wants a sister. I wanted a sister. But I was like, well, you're not going to get one. I'm sorry. You can just have friends.
Hannah,
my cousins.
Yeah, Hannah keeps saying that. Brother. No brother. No, we're not doing a brother. 2 and done.
Yeah.
We're not doing that.
Yeah. Yeah, it's kind of a good balance. I mean, I was one of 3, and you go to a hotel and one kid's left out, or one kid has to sit in the middle seat, or one kid has to sit in the back row, or you go on a roller coaster and somebody's left out. Like, there's just odd numbers are hard. I think you almost have to have even, and I am not having 4 kids, so we are content. And I just really, the stress of being pregnant and getting through a pregnancy is just a lot, and so we're just grateful and happy that we have our kids, and they're healthy, and we get to enjoy them in this season of life and everything that they're going through, and getting into sports and activities, and traveling is getting easier. Finally feel like we can go places without it being a huge struggle and packing everything. So
I just can't even imagine. Like, I was so stressed and worried about my pregnancies, and they were, compared to yours, incredibly easy. But like, I can't even imagine the stress. And like, for your daughter, was it like just a constant like warfare with your own mind? Like, did it feel like that pregnancy was a very long pregnancy, or how did that feel?
yeah, I was monitored so much during it that I really thought it was going to fly by. But I just remember, once I got further, and like that last hospital admission that I had, I remember telling myself, like, I think I'm okay if this baby comes out. Like, I was just so exhausted mentally, emotionally, physically. And then of course you're worried, right?
Yeah.
Like, the stress. I mean, it started at 23 weeks pregnant, and I'm like, if I can't have this baby at 23 weeks pregnant, like, I mean, babies can survive that young, but that's just way too soon. So, and it really became, thankfully, my job was so accommodating, and I was able to go, on like light duty. I actually stuck out that job a lot longer than I should have, and mainly it was because just I had that seniority and that respect for my management that I could take the time off if I needed it, and nobody was gonna question me, because they all knew what I had been through, and they weren't gonna jeopardize that. So it was nice to have that. So
right.
That's such an interesting component to having medical knowledge and going through it that way. Like, I would imagine, and we talk about that on this podcast, like, some of us are really good with having data and knowing things, and others of us like to live in the dark. And I can't imagine, like, like you said, you didn't know everything, but man, knowing some of the stuff you knew, like, was like you said, I think it was somewhat probably more comforting, but was it like also scarier, do you think, than a normal person who didn't know what was going on?
yeah, I don't know. I mean, I would be curious to be on the other side and not know the medical and how I would feel about it. I mean, I think, especially being a pediatric nurse, I see both sides, right? I see the healthy kids that just have like a one-off surgery or have to get admitted for dehydration or something. And then I see the kids that, were born super early and have all these medical issues, and they're in the hospital all the time. And, they didn't have anything other than that they were just born early. And so, yeah, I don't know. It's both. I think that I had a lot better of an understanding than like my husband did. He was really nervous to have a second baby. And I think when we were struggling, I remember at one point, probably a year in, he's like, we should just stop. Like, I don't want to do this. And I'm like, hold up. Like, we've already been doing this for a year. But I mean, I understood, because it was really scary. And I think being on his side of it, just not understanding and worried about me, obviously.
Totally.
And then, like, our child, and, it's risky. I mean, pregnancy is not for the faint of heart. It's a scary thing. There's a lot that can happen. A lot of things that you have no control over too, but
it's funny talking to moms who have been through like a first pregnancy that's so hard. And then when you're like, all right, let's do this again. And your husband's like, wait a second, I don't want to lose you. And that's very scary. Yeah. Very scary.
What would be your advice for people who have been through miscarriages?
It's one of those, it's hard. I've had friends that know that I've had miscarriages that have reached out to me. And I've just kind of really been just like a sounding board for them, like I know the emotions. I know each day is different. You're okay and then you're not okay. Worry about growing your family. But I think the biggest thing is just um, to really just make sure that you're ready to really move on. And we had taken a couple, we took probably like almost 2 months off in between each of the losses. And then obviously it took us time to get pregnant in between the last two. But it's what, like I had said, I had a really hard time telling people that I was pregnant early on. It was really hard because I'm at work and I'm going through the motions, and I give chemotherapy for my job, and that's something that you're like, it's a really high risk thing to be doing that when you're pregnant. And I did it because I didn't want people to know that I was pregnant, because I didn't want to have to go back and tell them that I'm not, because I had done that the first two pregnancies and it was just hard, and then it's I'm really sorry this happened to you, but you can keep trying or you can try again. And that was really triggering. It's like, just, you need to, I think people just need to acknowledge that it's somebody's story and it's their own time frame and how they want to move through it in their own way, and just being supportive and being the person that they can listen to and just vent and know that you're going to be that support. But I think once you've had one, 1 in 4 people have a miscarriage. It's crazy. I never knew that, but that's 25% of of pregnancies end in miscarriage. And then, they say once you've had one, the chances of you having a successful pregnancy after is very high. But I know people that have been through, 10, 11, 12 that have had to like do embryo adoption, or then like have like I know one girl that I follow in the infertility world had a surrogate carry a baby. I think she had an embryo adoption, and then she did IVF, and then they ended up getting like pregnant spontaneously on their own, which is just crazy. Just to see the stories that it really can happen, and just the strength of people that have to go through all of that. And even just fertility and fertility treatments are hard enough in itself. Like Leah, you went through it, and I, I know people that that's their only way that they're ever going to be able to have a baby, and it's its own separate hard thing. It's hard. I think this whole world is just, trying to conceive, and pregnancy and all of it is just a really hard thing to navigate. And I think people really just need to be ready for it. But we all know what the end result is and the end goal, and we all know how amazing and rewarding it is when it happens. It's just the battles you have to go through. But I'm glad I'm done with that time in my life. I am fine and done, and I don't want to have to ever stress or worry about another pregnancy, because it's just a lot mentally.
And I guess my other question is, how are you? How did you recover? Like, what was your postpartum like? Are you feeling happy and healthy now that you're a couple years removed from all of that?
I just recently I kind of realized I think I still have a lot of trauma that I need to work through. And I've never sought out therapy. I'm actually going to be starting. I think it's just like motherhood in itself is really hard, and I feel sometimes you feel kind of isolated, even though you have your community. But I still have a little bit of that trauma, and I think I blame myself a little bit. I had a really, really, really hard time with my son's pregnancy or postpartum. And I think part of it was that I was non-weight bearing. I had my leg, like I was very invested in myself and not as much with him. And it was hard to connect. Like I never really could baby wear him because I wasn't going to baby wear him when I was non-weight bearing. I didn't want to fall and trip. And, I never carried him around the house. I would have, the bassinet next to the bed, and I would have him in the bed and in the bassinet. And then when we were ready to get up, I would like call my husband on my phone or his phone and be like, can you come get the baby? He'd come and bring him out to the living room. And then I had my setup out in the living room and he would be out there all day with me. And, it was just back and forth. But I wasn't alone with my kids for the first few weeks, which was really hard. All you want to do is be able to be a mom to your kids. And I couldn't. And I remember I went to they start doing those postpartum screenings at your baby's well checks. And I failed. And I remember the nurse practitioner that we saw the first time, brought me resources and she's like, are you okay? I'm like, I'm fine. I can't, I'm having a hard time coping because I can't carry my kid. I can't drive my kids independently on my own. I can't take care of them. Somebody's got to be with me all the time. It was really hard. But obviously the second I was able to walk and get up on my feet and start doing those things, it really helped to heal me because I'm like, I can do this. And I just had a little bit of a delay and I just had to really process it and give myself the time.
How many weeks postpartum was that you were able to do that?
So I was non-weight bearing, I think, for 3 more weeks after I had him. And then I was able to start walking, but it took me a long time. Like my leg was so weak. I was dealing with a lot of swelling and a lot of discomfort for probably, I had him the end of May, maybe the middle of July, when I finally kind of felt, so almost 2 months postpartum.
Wow.
And, I was going to physical therapy twice a week to try to strengthen myself and get myself back moving. So then I was away from him. So he had to take a bottle pretty much too, because I was away from the house and couldn't take him with me because it was 2021. Dang COVID. Just really threw a wrench in stuff. But yeah, so I think it was like the middle of July. Thankfully our parents are all here locally, so that was a huge help. My mom was really the only person I trusted to be with me for my doctor's appointments if my husband wasn't able to be there. She just knew how to get me out of the car, and she knew how to, I didn't want to have to tell anybody else where to park the car and how to get into the doctor and where the doctors. I just wanted her to just be able to take me and drive. And so between her and my husband, and then we had to have somebody home with my daughter. So it took a village. People had to come clean my house for me because I couldn't do that. Wash the baby clothes, all the things that I didn't get a chance to do because I was 32 weeks pregnant. I still thought I had a few weeks to get all that done. So I remember sitting on my little knee scooter in the nursery while my husband was hanging stuff up on the walls. And I'm like, I want to do that. I want to hang it up on the wall, but I couldn't. So I just sat there and just directed him with my knee scooter. But
That's the worst. I feel like having to tell your husband, just let me do it, but you can't. I can.
yeah.
When you know exactly how you want it to be done or something. Though the cleaning the house,
Yeah.
I would love for people to come clean my house.
Especially during those first couple weeks, right?
Yeah.
Yeah, but I'm so sorry that you had to go through all of that. That sounds like I just feel like when you describe Mackenzie as a fighter, you're a fighter too. She gets that honest, and I can't even.
Yeah, I mean, you fought for your children, and
Yeah.
you did a great job because you got them here happy and healthy. You went through hell to do that, but man, I I don't know. I guess I'm at a loss for words because I admire what you went through with your daughter, and then the strength and courage that you put front to potentially go through some of that stuff again when you got pregnant with your son. And I mean, you've got a beautiful family now, which is amazing, but
Yeah.
you've been through a lot of shit.
Yeah.
And I was thinking when you were talking about being pregnant with Jackson, for me, sometimes I'm worst case scenario. I stress about the smallest things. And I was wondering what kept you going, what kept you positive, or were you just a wreck every single day? Because that's how I feel like I would be.
Yeah. My daughter's pregnancy was so long ago that honestly, I'm glad I took notes because I blacked out a lot of it at this point. not just because it was 7 years ago, but it was traumatizing. And I have learned through the entire experience, like I journaled a lot and I wrote down my thoughts and my feelings and like just everything that was happening because it just really helped me process and cope. And that's always kind of been my thing, my therapy in a sense. Like I find myself in like a moment of just frustration and I'll get out my phone and like a little notes app and I just type away and it's like, okay, I've put it away. I've put it on paper. It's not mentally in my head anymore and I can move on. But I just remember journaling helped a lot. My friends and my family just being really supportive was obviously huge. I posted like a weekly bump update with my daughter, and that was kind of my thing. Like, this is me. Every week I've done this. Like, we've gotten this much further. She's this much bigger. And I did monthly milestone posts for her, the first year that she was a baby. And just, we did this. Like, month 3, this is what she's accomplished. Like, this is how much she weighs. Like, we're gaining weight. We're doing everything we need to do. And it was just kind of my way, not because I was like, I want you all to know what I'm doing, but it was my way of just really getting it out there and, coping and not keeping it mentally inside of me. But, yeah, it was traumatizing, but I think a lot of it, I've either totally just forgotten about it. I had to like go through all my notes and take notes on my phone because I wanted to make sure that I got everything in the timeline that I got it in, because it seems like a blur now.
Yeah.
But I made like a scrapbook of my pregnancy with her. And so it'll be really cool one day to show her that and to be like, this is what I went through. And I have plans to do it for my son too, but here we are 3 years later and I haven't done it, but I'll do it eventually one day. Like, I have everything documented, even if I just print the Instagram pictures and the updates that I did for him, like through my pregnancy. But, it's just something cool just to be like, I journaled and I kept track of this and this is what, mommy and daddy went through. And
that's so great. I think even, event, obviously, like, it'll be probably a while before they'll be able to appreciate those, but eventually I think they'll go through and be like, wow, can't believe you did
yeah.
that. I mean, that's cool. I'm interested to see how therapy goes for you, for sure. I've been in therapy for a while, so and I know sometimes they hash up those things and you think you don't remember, and then they say something that triggers a memory and you're like, oh, I didn't remember that until just now.
Yeah, I think it'll help me. I just have really not, I haven't really put myself first,
Right.
Like, I think we're all about our kids all the time. And I think I'm now at this point that I'm like, okay, like my son's 3, like I need to do something for myself.
Good
and
for you.
kind of get these emotions and work through stuff. So that's kind of my, mental journey that I'm going to be taking here soon. Taking that step forward from what I've done in the past and kind of hash some of those things up, because I still think I still deal with my leg and I still deal with a lot of issues from it 3 years later. It swells and I have a lot of like, I can't, I don't have full mobility and I don't think I ever will. And so that's hard too. Like I'll be on the floor playing with my son and I try to get up and I'm like, I can't put that foot down first. I got to put my left foot and I got to push with my right because I can't get up off the floor. I'm 80 years old, but I'm on the floor trying to play with my kids and, going up and down stairs and picking him up. And, that was all really hard at the beginning where I'm like, I can't put him on the floor to play because I don't think I'm going to get him back up off the floor. So it's just all those things. Mentally, I just think I need to work through it more so than what I've done on my own, and it'll be good. I think it'll be really good. I have a lot of friends that, do therapy, and I'm not like, I've never been against it. It's never been something I've really put forth the effort to do.
Sure.
So
that's awesome that you're doing it. I think making that first appointment, just doing that is such a huge step and in the right direction. That's awesome.
Yeah. Well, we do have one more question for you. First off, thank you for sharing all that and being vulnerable. And I know that listeners will hear this and hopefully, someone that might be going through something very similar or has went through something similar, like knows that they're not alone. And that's that's why we started this podcast, is just to hear real moms talk and like talk about the things that people don't typically talk about. Or at least, like, I know my parents, or I don't know any, never talked about this stuff, or my mom. So it's just, I'm so happy that you got to join us. And I'm so glad that you listened to our episodes too. That's awesome. All right. So our last question is, what is your best parenting advice, or what is the best parenting advice someone has given you?
I think the best advice that I've gotten from people and that I tell people is just to not compare yourself to anybody else. Everybody's pregnancy journey is different. Everybody's, their journey with their kids and the years and the things that happen. I think everybody gets really fixated on, my baby needs to be crawling by 6 months, and they need to be walking by 12 months, and they need to be potty trained by 2. And it's just, there's so much pressure. And I think social media does not help. And I think I've always just told myself, I catch myself all the time looking at somebody else and saying, how come their child's potty trained? Or how come their kid's talking a lot more than mine? Why is my kid not talking? And I have to tell myself, your kids are your own kids, and you need to not think that they're on their own journey. They're meeting their milestones at their own time, and we just need to not compare ourselves to others. I think we need to be like more supportive of each other and not, so judgy. Not that I am, but I think I just try to tell people when they're starting their journey, like, don't compare yourself. Don't see the milestones that you see and take that as that's where your baby has to be. And if they don't meet that, they're not on their right track. So
That's really good. I like that. I will say my mom just asked me last week. She's like, have you started potty training Weston? He's 15 months old. I'm like, no. She's like, why not? She's like, we started potty training you and your sister at that age. I'm like, sure you did, Mom. Okay. I was like, I haven't even thought about it. And then she's like telling me what I need to do. I'm like, please stop. Like, I didn't ask for this advice. I just called to say hi. So yes.
Yeah.
That's what when you said potty training, I was like, that's what I thought. But yeah, absolutely. We definitely need to be more supportive, and just, know that our kids are all on a different path, and they're in their own person. So I love that.
Listen, I have no idea when I started walking, when I was potty trained, and when I started talking.
Me neither.
But I think I'm doing okay most days.
Yeah.
Yeah, we're all potty trained now, hopefully.
Yeah.
Except when you're super pregnant.
That's true. My son's pediatrician just told me 2 weeks ago that he won't be going to kindergarten, not potty trained. And I'm like, well, I don't know about that. But we are still a couple years away from that. Because we are in the temper tantrum, no, I don't want to do that, I'm refusing to sit on the potty phase. And I was pushing it, and she said, don't push it, because it's not going to work well. If he's not ready, he's not ready. And as soon as they're ready, it'll get easier, hopefully.
My cousin's son was 4.5 and not potty trained. And he's obsessed with Disney and obsessed with Mickey Mouse. So they said, we can go to Disney World, but you have to be potty trained to go to Disney World, because Mickey won't see you if you're not potty trained. He was potty trained overnight.
Wow. Before we let you go, Ashley, for any listeners that have been on the edge of their seat this entire time, waiting to find out if my husband actually did know that Tyler's first name was not Tyler, I have an answer.
Okay.
He did know.
Okay.
And he even said the right first name. So sorry, Bryce, for doubting you.
Should I call Ryan up here?
Now we all know.
Should I call Ryan up here and ask him?
Maybe. If Bryce knows, Brian.
Are you sure?
Yeah, if Ryan doesn't know, then you'll have to let me know, and then we have a problem.
I could just call him up and ask him on the spot. Okay, Ryan knew, and I feel like you can hear my heartbeat. I ran up the steps. Ryan's playing StarCraft downstairs, and he said that he's about to beat this guy, so he said he couldn't quit his game.
Come up.
Huh? Yeah.
He didn't want to be disruptive.
No,
but you got the answer.
Yeah, it was David. He had it. He was like, I can come up, but he's like, I'm beating this guy. The other day,
So funny.
He loves when I do podcast nights because he plays his little game on his computer.
Steve does too. Steven loves it. As you guys have heard in the background of previous episodes.
Nice. Well, thank you, Ashley.
Yeah.
Thank you so much, Ashley.
Yeah,
Thanks
thank
for
you.
sharing your
It's a
story
wild
with
story.
us.
Oh, no kidding.
Honestly, the more I tell it, I mean, I've told this story to so many people. Like, I just started my new job, and I was like, I was only 9 months postpartum, so I was still like, couldn't go up and down stairs, and I was like, just letting you guys know, like, this is my story. And they're like, did you just have your baby? I'm like, yeah, that happened while I was pregnant. And so it's always just, and these girls that are younger than me, like 12 years younger, dating, not even married, they're just like jaw dropping. I'm like, just you get ready. And if you ever need anybody to talk to, I have basically almost seen it all. So I mean, I've always been supportive of my friends, and I know a lot of people that have gone through miscarriages that have reached out to me, and they're like, this is happening to me. And I'm like, yeah, let me, get ready, but I can support you and talk you through whatever you need me to talk you through, and kind of just be that sounding board because I've been through it. I've gained support of other people that have had high risk pregnancies, and just people, I mean, even just people on social media that I've ran into that we don't know each other, but we message back and forth, and just to have a support to be like, yeah, I've been through the same thing. And,
That's awesome.
I have a success story, or my kid was born early and they were in the NICU and everything was okay and fine, so, but yeah, thank you. It was, it's always hard to talk about my journey, but it's always a fun thing. I mean, I enjoy it, just to kind of get it out there. And it's kind of, like I said, just like writing it down, speaking it out is kind of therapy for me too. So.
And that wraps up another episode of Mom Jeans, trying to fit into motherhood. Thank you again so much for listening to us. And if you enjoyed this podcast, please consider giving us 5 stars so other mothers out there like you can find us and listen. If you would like, you could follow us on any of our socials at Mom Jeans, the podcast. If you have questions, would like to send us your birth story, or give us suggestions or things that you would like to hear, please email us at hello@momjeansthepodcast.com. See you next week.